We log roll the patient to examine the back and to get them off the spinal board. During the log roll, the patient is turned as a whole with no spine twisting. 4 or more people are needed for the log roll. One person holds the head and neck. This person coordinates the log roll. 2 or more turn the torso. Each person's hand should crisscross with another person's hand. The last person will examine the back. The person holding the head and neck will coordinate by a count of 3, and everyone will move in sync, turning the patient 90 degrees to allow for back examination. Once the back examination is completed, the coordinating person counts to 3 and turns the patient back to a supine position.